Hi guys, this is Preeti and you're watching Med Resolution. In this video, I'll be teaching you the RS question, that is RS3, that is pectoralis major muscle. Introduction, this is the largest muscle in the pectoral region. As you can see, this is the pectoral region, this is the largest muscle and this is a thin muscle, thin flap. This is a thin flap which is the largest muscle in the pectoral region. It has two heads, a sternal head, this is the sternal head, this largest sternal head and smallest clavicular head. As you can see, this is a fan-shaped muscle, thin, largest muscle in the pectoral region. It has two heads, sternal head and clavicular head. Sternal head which is the largest head and clavicular head which is the smallest head. Clavicular head which is the smallest head, sternal head which is the largest head. And in this video we will be discussing about the origin, insertion, nerve supply, action and clinical testing of this muscle and congenital anomaly. Origin, it has two heads, as I said before only. It has two heads, clavicular head and sternal head. Clavicular head, this is a clavicle. If we divide the clavicle into two parts, it takes origin from half of the medial, this is the medial side of the clavicle, this is the lateral side of the clavicle. It takes origin from the half of the medial half of the clavicle, that is the superior surface of the clavicle. And other head, that is the sternal head, it takes origin from lateral part of the sternum bone, lateral half of the sternum bone, that is anterior surface of the sternum, and then medial parts of the, this is the ribs, costal cartilage, this is a costal cartilage, this part, medial parts of the second, third, fourth, fifth and sixth rib. So medial part of second, third, fourth, fifth costal cartilage, and it is inserted into the lateral lip of the bicipital groove. As we have discussed in earlier videos, that is, this is a greater tubercle, this is lesser tubercle. In between those tubercle, this is the bicipital groove or intertubercular circus. Intertubercular circus has medial lip, lateral lip and a groove. It is inserted into the lateral lip of the intertubercular circus, pectoralis major muscle. And nerve supply, origin and insertion we have discussed, that is clavicular head, anterior surface of the medial half of the clavicle, sternal head, anterior surface of the sternum, medial parts of the second to sixth costal cartilage, and aponeurosis of, here you can see external oblique. External oblique is a muscle of the abdomen, superficial muscle of the abdomen. It lays origin from the aponeurosis of the external oblique muscle. And insertion we have already discussed, that is lateral lip of intertubercular circles. Nerve supply for pectoralis major muscle and pectoralis minor muscle, for both pectoral muscles, it is supplied by lateral pectoral nerve and medial pectoral nerve. Root value for lateral pectoral nerve is C5 to C7, whereas root value for medial pectoral nerve is C8 to T1. So completely C5, C6, C7, C8 and T1, all this forms brachial plexus. So it forms all the segments of the brachial plexus. After nerve supply, we will discuss about actions of clavicle. Actions of pectoralis major muscle. Pectoralis major muscle has two heads, clavicular head and sternal head. Clavicular head flexes the arm. Clavicular head, as you can see here, it is inserted into the humerus. It flexes the arm, whereas the sternocostal head, it rotates the arm medially and then abducts the arm. Adducts means it brings the humerus close to this ribs. So it adducts and medially rotates the arm. And clinical testing on lifting heavy load, clavicular head. This on lifting heavy load, this clavicular head becomes prominent, and depressing that load, this sternal head becomes prominent. As you can see, on lifting the heavy load, clavicular head will become prominent, and depressing costal head becomes prominent. Congenital anomaly in few of the persons. In pectoralis muscle, major part of the pectoralis, the part of the pectoralis muscle, that is sternocostal part, will be absent at the birth. This causes weakness, as we have discussed, that sternocostal part of the pectoralis major muscles adducts the arm and medially rotates the arm. So in the persons with absent of this sternocostal part of pectoralis major muscle, they have weak in adduction and medial rotation of the arm. Thank you. That's all for this video.